Hi guys, this is Lyndon Littlefair from Yummy Tummies, the Postnatal Exercise Specialist. In this video today we're going to be talking about abdominal separation during your pregnancy and in the postnatal period. So first things first, in terms of I want to talk about abdominal anatomy a little bit more, so you have an understanding about what happens throughout the pregnancy and what happens afterwards in terms of regards to the abdominals. So first things first, from the stomach point of view, we have the six-pack muscle, the rectus abdominis, the muscles which run vertically down through here. Okay, these are the ones which actually separate through the pregnancy. On the outside you've got external obliques, underneath that you've got internal obliques, okay, and they cross in a different direction. Underneath all of that you've got what's been referred to many times as the core, which is the transverse abdominis. Okay, throughout the pregnancy what happens is baby needs room to grow, so what happens is these muscles down the front, the rectus abdominis, they tend to separate. They tend to sort of just create a bit more space, okay, just so you have some space for the baby to grow. There's a ligament sort of system down through the front here, connective tissue I should say, and literally what that happens, it's called the linea alba, and that as those muscles separate, that tends to stretch as well and becomes a little bit more thin. Okay, postnatally what happens then, muscles tend to come back together. Okay, and this can take time. It also can take a lot more time depending on type of pregnancy, size of the baby, and depends on your muscle recovery and lots of different things. If, for example, their glutes are really strong, doing lots of work, they tend to stop these muscles from coming back in as quick as possible. This is normal. Abdominal separation is normal through pregnancy. Okay, so it's very rare that you grow the baby without creating some extra space. So most people get very worried about it. Don't be worried about it. Just be aware of it. So there's a certain implications about what you can and can't do straight away afterwards. The big thing is a lot of people worry about getting them right back together. Okay, the best thing you do if you're just watching this when you're just pregnant, with no bump at all, no slight change in the stomach at all, is test the abdominal separation now, because it depends on what the abdominal separation was to start with, is how far you can get it back. If you look at, probably the best thing to do is look at athletes and look at when they mostly got the shirts off. Some of them have got abdominals which bunch right up together. The rectus abdominis, those muscles are touching together. Some have slight separation, some have a big separation, and that's all a lot to do with genetics. So if you're one of those people with the abdominals separated slightly to start with, and postnatally you're trying to get them back together, it's like, well, if they're not there to start with, they're not going to go back there afterwards. So if you're watching this and you've just got pregnant, please, the best thing you can do is just test the abdominal separation now, then you've got some sort of benchmark to go with. Okay. What I wanted to do now is show you how to test for this abdominal separation. Okay, so you can have a bit of an idea about how far it is, how it's progressing along. So, best thing to do with this one is lying down on the floor. So from here, knees bent up, nice comfortable position. Get you put both one hand vertically running straight down and start at your belly button. Okay, just find your belly button. Okay, and just palpitate or push around the stomach and just got a bit of a feel to it. Right, what you're going to be doing is take a little, tense these muscles up, do a little partial crunch, just enough to activate and so you can feel these muscles working. Okay, you're not coming in full sit up or anything, just nice and comfortable. And what you're doing is you're feeling for the outside of one of the muscles on one side and the outside muscles on the other side. Okay, so that literally is feeling for the gap. Okay, and what you can do is put it on the side and just go by your fingers and say, okay, is it one, is it two, is it 3 finger separation right in the belly button. Okay, once you've found that, rest a bit. Okay, come up again, test again and see how it feels. Okay, once you've got that, just write a note down. See how, write a note in terms of what it is, if it's 2 fingers, and write today's date, so you get an understanding where it is now. That's at the belly button. That's always going to be the widest, not always, but most of the time it's going to be the widest point, because that's where the abdominals separate the most throughout the pregnancy. Then if you can just go slightly above, about an inch above, and do the same thing again, crunching up, a little partial crunch, and just test it, see how it feels, see if it's more or less in the belly button, and just write a little note down. Come further up, same thing again, and then one more time just on the rib cage and come further up. So that way you get an understanding about where is at the belly button, how it's coming together or not together at the top, so you get an understanding through here. Then do the same thing for just below the belly button as well. Okay, it's the same thing. Place your hand vertically, little crunch, and just get a feeling for if there's any abdominal separation there, how much, how many fingers, etc. Just below the belly button. Okay, so once you've got that, once you've got an understanding about literally how far the belly button is, how far the separation is, you get an understanding about how that's progressing over time. But as I say, the best thing to do is when you first get pregnant, do a test then. That's the best thing to do, because then you've got some really good benchmark. Don't get obsessed with this. Don't get obsessed with the amount of separation. Don't get obsessed with if it's big separation, etc. You just need to be careful, especially in early stages, because if you've got good abdominal separation and that linear elbow down the middle is quite thin, that's when you run the risk of of hernias and different things like that. So it's just going to be quite careful and just use that time for recover. So if you like this video, if you basically want to see more information, I'll be putting a lot more information out. Click on the subscribe button or the follow button, and we'll see you in the next video.